Hello, everyone, and welcome to today's ADAA webinar, celebrating Pride and LGBTQ resilience. We are so excited to have you all here with us today. I would like to introduce our wonderful presenters. Dr. Jeff Cohen is an assistant professor of medical psychology and psychiatry at Columbia University. Where he's active in the domains of education, clinical care, and research with a particular focus on the mental health of LGBTQ young people. Thank you so much for joining us today, Dr. Cohen. We also have Dr. Colleen Sloan, who is a clinical psychologist at VA Boston and an assistant professor of psychology at Boston University School of Medicine. She is involved both locally and nationally in education, training, and consultation in sexual and gender minority. Thank you both so much for joining me today.
Thanks so much, Sasha, and thank you so much, everyone, for joining us today as we continue during Pride Month for LGBTQ+ folks and identities. Happy Pride, everyone. We're really looking forward to talking with all of you today and providing some kind of brief education and background regarding resilience and its relationship to health of LGBTQ+ people. And then are really excited just to engage in a community conversation and dialogue around ways to promote resilience for the LGBTQ+ community, both for folks who have lived experience and for those who are demonstrating or engaging in allyship. All right, so before we get started in talking about the importance of resilience, I just wanted to offer a definition as proposed by Oxford Dictionary. So what is resilience? It's defined as the capacity to recover quickly from difficulties or toughness. And I don't know about all of you, but I'm speaking for myself personally as a queer woman. When I hear the word toughness, I do have a sense of pride. It makes me feel proud of myself to be tough. And at the same time, I feel a bit of sadness when I think about this first part of the definition. So this idea that we need to be recovering from difficulties. But I think when we're talking about resilience, we need to be talking about this in the context of, why it's even relevant. Resilience is only relevant or necessary in the context of difficulties or stressors. And so I'll ask Jeff to advance our slides so that we can talk a bit more about how resilience impacts our health. And so this is an adapted model from a health professional researcher, Elon Meyer, that talks a little bit about how, for those of us with minoritized identities, we experience unique stressors that can have a negative impact on our health. But before I talk about that, I just want to mention that stress impacts health and resilience can help protect against those effects. And so for any person, regardless of identity, we experience general stressors. I'll just give it a quick example. I got a message from my mother this morning who lives in Florida, and they're experiencing a heat wave right now. She mentioned to me that yesterday it got up to 104 degrees. And for myself, I'm very heat intolerant, so that sounds miserable to me. And then she shared that last night her air conditioning broke. So I feel like I can safely say that we all would probably experience that as stressful. And my mother is a white, cisgender, heterosexual woman. And so she does not have the additional stress of worrying about being misgendered or discriminated against based on her identities when she contacts folks to help her repair the air conditioning. So there are differences between general stress and stress that minoritized people experience. And so if you look in the middle of this model, there are stressors that are unique to minoritized individuals. So these are things like prejudice, discrimination, things that happen inside the environment. It's important to recognize that these are systemic and happen at multiple levels. So on the individual level, for example, being discriminated against in an interpersonal interaction, experiencing absence of protections within employment settings, or just harmful pieces of policies and legislation. And we may be bombarded with messages that are There are things inherently wrong with our minoritized identities, which can lead to the internalization of that stigma, or otherwise just buying into those negative beliefs and maybe starting to believe that about myself, something's wrong with me. I'm flawed in some way. So I might also learn to conceal who I am as a person, so that I can avoid some of those negative experiences, which in itself is inherently stressful and difficult to navigate, particularly across various contexts. And I might even start expecting rejection from people, which of course is reasonable and adaptive in some ways because I may have actually had those experiences before. But nevertheless, those are unique stressors that I might carry as a minoritized person. And those experiences in themselves can lead to negative health outcomes, both mentally, physically, and just my general sense of social and psychological well-being. And so you see at the top here are examples of resilience factors or resources. And with the arrows on this diagram, you can see that these help protect against the effects of stress. And so these are things or include things like identity affirmation. So just being affirmed in my identity, in my authentic self, in my whole self, access to effective coping resources, connection with social support, again, social support that is affirming of my identity, connected with others in my community or those who have shared lived experiences. And then importantly, pride, which is kind of what the theme is of June and the entire month. Why is pride important? Because it is literally the opposite of an emotion of shame, which is what many minoritized people feel due to the inherent invalidation and discrimination that exists within the larger sociocultural political environments. And so you see these larger arrows going up and down. Generally speaking, what we want to do when we're thinking about ways of promoting positive health outcomes for LGBTQ+ and other minoritized people is to decrease the presence of minority stressors and work to increase resilience factors and other resources. And so for folks who are particularly invested in allyship, for those folks, there's a responsibility to really work within the larger environment to reduce minority stressors. Turn it back over to you, Jeff.
Thank you so much, Colleen. So we're going to be focusing on resilience today, so on the up arrow, and we're going to be talking about how we can all amplify resilience, whether we're striving towards allyship or identify as a member of LGBTQ plus communities. So before we get into that, we just wanted to talk a little bit more about allyship. We've been talking about it as a verb versus a noun, meaning it's not an identity to claim, but rather a continual process. We've also been talking about allyship as a value. And so a value is something that doesn't necessarily have an endpoint. However, there can be action steps along the way. For instance, I sometimes think about a metaphor of going west as a value. So I'm in New York now, I could get to California, Asia, Europe, and back to New York, but I could always keep going west. Similarly, I could always engage in allyship, and there can be different actions that I could take along the way. In just a bit, we're gonna invite everyone to share actions they might take to engage in allyship or what they hope those folks striving towards allyship might do. But before that, we wanted to go in depth with one particular area, and that is related to pronouns. We're thinking of this as a model of resilience because it can really amplify identity affirmation. So here we have the Merriam-Webster Dictionary of Pronoun. So a pronoun such as I, you, or they expresses a distinction of a person. And of note, they actually was a plural pronoun back in the 14th century. In the 18th century, they was a singular pronoun back in the 14th century. Then in the 18th century, they became a plural pronoun. Now in the 21st century, we're seeing they used as a singular pronoun again. Point being, language can shift and change over time. So they can be used to refer to a person, perhaps when the gender is unknown, immaterial, or the person identifies as non-binary. It can be used in a variety of contexts, not limited to those, but those are some examples. So everyone has unique pronouns, and some people could use one set of pronouns, and other people may use combinations or several pronouns, including she, he, and they. There's additional pronouns, which we've included on this slide. And so you can see examples of gendered and gender neutral pronouns. There's also neo-pronouns, which you can see in the bottom right. We've also been thinking about how pronouns are not preferred because they're not about who we prefer to be, they're about who we actually are. So when referencing pronouns, we can simply just state pronouns. So on that note, we wanted to talk a little bit more about how to normalize using pronouns. So they can be added to introductions. So you could say like, hi, my name is Jeff Cohen. I use he, him pronouns. This can create space for other folks to share their pronouns if they would like, or can indicate that it's a safe space to share pronouns if people would like. You could also consider adding them to your email signatures, your Zoom handles, your social media bios. Now, what happens if you misgender a person? This can occur accidentally, it can occur intentionally, but what happens when you use the incorrect pronoun? So we've been talking about doing intentional apologies, where you apologize, however, not so profusely that the person then feels they have to reassure you that it's okay, and you commit to doing better in the future. A lot of times, clinically, I work with parents, and understandably, they tell me it's very hard to maybe use their teen's pronouns, given the pronouns the teen was assigned at birth differ. So sometimes in that scenario, you can just work on using a person's pronouns when you're alone and saying them out loud. You can also practice introducing yourself using pronouns, and you can do that at home. So then you're prepared in real life conversations. So here we have a question that I'm actually gonna popcorn to Colleen.
Thanks, Jeff. And I really appreciate your attention to pronouns. And so I identify as a cisgender woman. And so my pronouns she, her are what are kind of stereotypically or traditionally associated with a woman's identity. And so I can use my cis privilege to engage in allyship for our trans and gender diverse communities by sharing my pronouns, even though I'm not necessarily at risk of being misgendered. And so that's a way of kind of, creating that space and using ways in which we might actually have privileged identities to engage in allyship. So I'll ask Jeff to just hop over to the next slide. So here are just a few examples, certainly not an exhaustive list, of ways that we can engage in allyship for the LGBTQ+ community. First is to just learn more about these communities. And I just want to add a caveat that the way that we do this is on a kind of our own independent time and not necessarily over relying on communities themselves to educate us. And so we can do this by joining social media groups or consuming media that might be specific to LGBTQ+ communities, just to learn a bit more about what issues might be important or the lived experiences of folks, since we don't necessarily have those lived experiences ourselves. Another way is just to get involved in organizations and advocacy. I do just want to highlight the importance of small grassroots organizations and advocacy. Is often an opportunity to be more productive. Oftentimes there's less bureaucracy. So getting involved locally is a great way of demonstrating allyship. Additionally, it's important to make sure that we are keeping ourselves educated and really understanding about policies and legislation that may be harmful to LGBTQ+ people. So, taking the responsibility and the ownership to educate ourselves, and then engaging in advocacy work to change those policies. So it certainly speaks to the importance of being active members within our larger democracy. And then lastly, when we do learn about organizations or policies or even businesses that may support harmful policies towards LGBTQ+ people or messaging, it's important to avoid supporting those businesses and organizations. So again, not an exhaustive list, but at least a good start. for those of you who may be wondering, what more can I do? So I'm just invite folks from our audience to maybe demonstrate into, or excuse me, enter into the chat. What can you do to actually demonstrate allyship? Any ideas from our folks? Ah, thank you. Yeah. So not to avoid folks because you might be unsure of their pronouns or identities. Maybe even asking what pronouns do you use, sharing yours, volunteering with affirming activities. Yes, absolutely. Visual cues of safety and affirmation are incredibly important. So for those of you in particular who may be in academic spaces or healthcare institutions or facilities, wearing affirming lanyards or having pens or any kind of visible cue on your person or in your the spaces where you may be working. I appreciate from one of our audience members staying quieter in conversations when appropriate or useful to actually center the voices of LGBTQ plus people. Absolutely. Or somebody just put speak up. Yes. And I want to validate that this can be particularly challenging when we may be in groups where what we're speaking up about might not necessarily be the popular opinion or statement. It makes it incredibly difficult. And part of truly engaging in allyship is speaking up when it might be really hard.
Encourage your agency to provide staff training.
Absolutely. Yeah, so I appreciate that many of you are actually, putting in multi-level interventions here. So on an interpersonal level, we can use our pronouns, we can speak up, we can provide corrective feedback within, environments of care or other, physical spaces. We can work to have visual cues and signage that are affirming and inclusive. We can work to advocate for staff trainings and promote educational resources at the local level. And then of course, nationally as well, getting involved in those national organizations. And we'll have again, not an exhaustive list, but a list of national organizations that are particularly well poised to promote health and advocacy and civil rights for LGBTQ plus people. Another example, changing documentation or forms to be more inclusive, absolutely. If any of you have ever gone to see a medical professional and you're filling out the demographics or the intake form and you notice that there is not a blank for your identity, that doesn't feel great and it's not affirming healthcare. And of course, as folks who may be in those environments, we can advocate to change that so that they are more inclusive, so that everybody feels like they have a voice and that their identity matters. These are great.
Yeah, really great. Thank you everyone for entering those. And so we're going to go on now, but we'll circle back to this because at the end, we'll stop recording and people will really encourage people to, join in the chat or to talk out loud about some more of these ideas, but we want to share a little more content with recording first. So we wanted to talk a little bit more about the factors of resilience. So as Colleen highlighted, these include identity and affirmation, and that can, that can include pronouns, that can also include affirming mental health and medical care. Coping, right? So what do we do in the face of stress? Social support. So if we find we're a tulip in a rose garden, do we look for a tulip garden? Do we try to advocate for the roses to accept us as we are? So those are some things to think about there. And then community connectedness. We've also been talking about how, to a large extent, the well-being of LGBTQ people depends on who surrounds them, not only physically, but virtually. I think that's something that we've seen play out in a number of ways during the pandemic. For some folks, maybe they lost their support community as schools were closed, for instance. Other people were able to maybe find supportive communities in virtual forums. So we actually are really curious just to sort of turn this over to you all as we just did, and get your ideas for what can be helpful in each of these domains. And to start, let's actually go with feeling connected and supported. So what helps you feel connected and supported? And I think, Sasha, we decided we'd stop recording here because we're gonna make it more of a conversation now. If people want to, they can turn on their cameras, and no worries if not, enter into the chat or just talk.
Thank you so much for joining us today, everyone. I would like to note that we did end the recording here to promote community conversation. If you are interested in exploring ADA resources, you can do so at adaa.org, where we have a Find a Therapist platform, free online support groups, and much, much more. Have a great day.